Hello, I'm Ahmed Abdelmaiz, a plastic surgeon and the founder of Plastic Surgery B project. Today we will discuss one myth about something most of the patients ask us about. Most of the breast augmentation patients, when they come to my practice, they keep asking me, is there any relation between aviation and breast implant safety? Is it safe to be on a flight with breast implants? So I did the research for you, and I'm so glad to share what I have found with you today through this presentation. So stay tuned. This is our presentation about if there's any relationship between being on a flight and the safety of breast silicone implants. So the root of the myth, it was a show that was called Thousand Ways to Die. If you try to find this show online, so you'll find that the genre of the show is docu-fiction, dark comedy, and horror. And in episode 948, it was talking about one lady that was on a plane and her breast implants exploded. So actually, when I looked online, I found three documented cases. Two were on the news, one Russian lady and one Vietnamese lady, and the third one, this was the only one that was in a scientific journal. And it was a letter that was sent to the Journal of Plastic Reconstructive and Aesthetic Surgery in 2014. And the authors, they have sent to the journal about that case, an in-flight rupture of breast implant pocket. The lady gave a history that she had breast augmentation of silicone implants 2 years ago. So I was trying to think about like one, logical cause behind this. Those accidents. So actually, I will try to make a fast recap on the physics of aviation and the air pressure. So if we look at the guy at the base of the photo, so he is at the sea level, and at the same time, the air around him, like the particles, they have no space between them. That's why the air pressure is very high. So he has like a high pressure by the base of the mountain, but when you like go higher to the top of the mountain, so there's more space between the particles of the air. That's why there's a lower pressure. At the same time, looking at that photo, so we can find that, for example, if you are by the base of the photo, if you are like on the altitude or the height of 100 meters from the sea level, so the pressure would be 1,000 millibars. So this photo is for Mountain Denali, and for example, like if you are at that height, you'll find the pressure is going less. If you are at the height of a commercial airplane, most of them like reach up to like most of the flight, it is at 36,000 feet. Looking at the next slide, so find that if there's an airplane on that height, 36,000 feet, so the pressure outside the plane will be 3.3 Pascal per square inch or PSI. So there's something called the air cabin pre-pressurization, and so the pressure inside the airplane at that height or altitude is 11.3. So the cabin is repressurized, so we can live inside, we can breathe inside and everything at that height. But at the same time, 11.3 is not the air pressure at the sea level, so it is still less, but you still can breathe. Like I found at some pages that it is nearly a quarter the pressure on the sea level, but we still can breathe and we still can do okay. So this may explain, like, so when you are inside the airplane on the maximum height that can reach 36,000 feet, and when the air cabin is pressurized, you are still surrounded by a low pressure. So this gentleman is called Boyle, and he's a physicist, and he came up with a law called the Boyle's law, and it was talking about when you surround a gas with a low pressure, so this gas expands. So there is like an opposite relationship between the size of the gas and the pressure around it. So looking at that, so when you are in the air cabin, even if it is repressurized, you are still surrounded by low pressure. That's why the gases they expand in volume. So looking at this photo, for example, if one of those cases, for example, used like low quality breast implant containing saline, for example, and this saline wasn't that pure, it had gases dissolved in it, and the airplane was like a very high altitude with very low pressure. So this gas dissolved in the saline, maybe it turned into bubbles and led to the breast implant rupture. At the same time, in the first few days of the breast augmentation surgery, when you insert the breast implant, the silicone implant, like manually or through the Keeler funnel or whatever the technique you use, so you push a little bit of air with it if you want that or you don't want it, so it will happen anyway. So the body takes maybe few days for that gas or for that air to be absorbed. So at the first few hours, first few days, if you are on an airplane and the pressure goes critically low, maybe this gas that is inserted while you are inserting the breast implant, maybe it will expand and may lead to the same result. So these are the explanations, the only explanations I could think about. I made a huge research about what is the percentage of females in general that have breast implants. So I tried here and there, and I found at the end from different sources that in the US at least there are 5% of ladies generally, regardless of the age group. So 5% of the ladies, they are having breast implants. So that means if you are on board, if you are on a plane, and half of it are men and half of it are women, so that means that 2.5 of the passengers, they have breast implants. Looking at, for example, the most commonly used airplane, this is the Boeing 747, and it has different versions, but most of them, they are going around that it has 550 seats. And that means that there is from 12 to 13 passengers. And of course, they are having, if we are saying 2.5%, so 12 to 13 passengers, they're having breast implants. And of course, we multiply by 2, because, like most of the cases, they have 2 breast implants. This is what Robin Williams here is trying to tell us. So from another website, following up the aviation like statistics and everything, so I could find that there's 12.6 million flight passengers per day, and this is like a huge number. I was surprised by that number, and that means that there is 314,000 female flight passengers with breast implants are boarding every day. When I say that line to any patient of mine, when they ask that question, it kills the question immediately. So that means that there is 13,000 female flight passengers with breast implants are boarding every hour, and that means that there is 218 female flight passengers with breast implants are boarding every minute, and that means that there are 4 female flight passengers in average, of course, with breast implants are boarding every single second. Thank you so much. Follow us on Instagram, watch us on YouTube, email us with what you think. Apis debemos emitari.